began to look at a solution like CrisisAlert when our staff expressed some difficulties with dealing with a different level of acuity in the patients that we were seeing than we originally anticipated. We're an outpatient behavioral health clinic. We took on some med management, and that just led to a different level than people were comfortable with and that they thought they would be dealing with.
We just felt like anyone could walk in and just do like the worst thing possible. Like, it was really fear-based, what we're thinking. And we knew we didn't have any kind of like protection in sight. So we're just kind of all like, oh, well, what's the front desk gonna do? Because we're kind of like the gatekeepers of the whole clinic. So like, we felt like this pressure to keep the whole place safe, especially for our patients and for ourselves too.
The biggest concerns were being prepared for escalating situations. It's a growing organization, and people were coming in with different levels of training or experience with behavioral health, and so the concerns were efficient ways to help bring confidence to everyone's role.
So as soon as they expressed that they were just uncomfortable with some of the escalations that they were dealing with and not feeling fully equipped in dealing with those, we decided to look at systems that we could put in place to help them feel safe and comfortable.
Once we heard that the badge system was coming in place, we were really hopeful. Like, we saw the light at the end of the tunnel, that we were gonna have something in place to help protect us. So
when someone presses this button, it responds on all of my devices, my watch, my computer, my phone, depending on where I'm on campus or even off campus. As a responder, I'm able to see where everyone is and what is happening in immediate real time. And that was my main worry, was that going to be as responsive in real time when that touch was going to happen. And my worries were put to rest once we were able to implement that, and on a daily basis, we're very pleased with that outcome.
I think workplace safety has improved tremendously. Having the response system has made it so that there is an efficient way to reach out if you have a situation escalating that you feel like you need help with. And so right off the bat, that's a big chunk and takes a big portion of the safety concern out of the equation.
just that immediate response is something that I love. Talking about how once I hear the doors open after I hear my button press, like it's not even a second after I hit it. So it's that comfort, the reassurance that my team is here for me to help protect me and the clinic too, because it's really important to protect both.
I do also sit on the Workplace Violence Committee for our healthcare enterprise, so for all of our service lines. And seeing what we were able to put in place has prompted a lot of questions from other departments who also deal with these sort of situations. It's not behavioral health specific. It's unfortunately something that healthcare in general sees across the board. There are other frontline folks dealing with aggression and different violent situations. So others are looking at what they can do to kind of help their staff as well, and how they feel comfortable in continuing their job and being able to continue in a safe manner. I think it's really allowed them to grow into their own, if you will. We're fairly new healthcare system in terms of our behavioral health service line. People were not real comfortable in the space initially. I think having the ability to again rely on that team gives them a little bit of a chance to play with some of the skills that they have learned and really be able to use those skills, knowing that they have a fallback, knowing that if they try to use those skills and something doesn't feel right, they still have backup that they can call. So there's a comfort level then in being able to practice a little bit some of the skills that they've worked on in that de-escalation space without there feeling like there's as much of as much on the line when it's just you trying to talk someone down.
The ability to have that additional sense of safety and security, especially during onboarding, being able to provide that badge to a new employee saying that this is something that you have for your security, for your protection, so that you can continue to do your job and best serve your patients. We're not asking you to go outside of that scope of your practice based on what we hired you to do here. We have people that have been trained as responders to participate in this program. All you need to do is just click it in a time of need and we'll respond. They feel such a sense of safety and protection and consideration. And I think that goes to what we were talking about before, about really investing in the people that work here.